I'll go ahead and get started. Again, my name is Miss Turner with Vidant Health Careers. We are Vidant Health in Greenville, North Carolina. We are the eastern part of the state, and we proudly serve 29 counties in eastern North Carolina. That's approximately 1/3 of the state, which is basically east of I-95 all the way out to the coast. When I say the coast, yes, I mean the ocean, out to the waters. It just kind of hit me last night as I was thinking about this, that last fall we did have a shark bite survivor share her story nationally about how she was received her care and her road to recovery on national television with Robin Roberts. So we do treat patients all across eastern North Carolina. We are Vidant Medical Center in Greenville, which is our flagship hospital. We're a level 1 trauma center with over 970 licensed beds. We offer cancer care, heart and vascular care, rehabilitation services, Vidant East Care, and as you'll learn about this morning, Maynard Children's Hospital at Vidant Medical Center. We have 8 additional hospitals throughout our 29 county region, as well as physician practices, home health, hospice, and wellness centers. We coordinate clinical education and residency programs with post-secondary educational institutions, and we also collaborate with secondary educational systems throughout all of Eastern region to offer programs to introduce students to healthcare pathways. In addition, we partner with Pitt County Schools and Duplin County Schools, offering a Health Sciences Academy program for high school students to gain exposure to healthcare and volunteer opportunities. Now we're ready to begin our video from Maynard Children's Hospital at Vidant Medical Center.
Children's Hospital. My name is Robin During. I'm a professional development specialist here at Maynard Children's Hospital. I am going to give you a tour and kind of show you a little bit of what Maynard Children's Hospital looks like. So just a little bit of a background information for you is that Maynard Children's Hospital is the largest children's hospital on the East Coast of North Carolina. We cover 29 counties from state line of Virginia all the way down to the state line of South Carolina. So because of that, we see a lot of pediatric patients that really need our services here. And so we designed Maynard Children's Hospital for children specifically, so that when they come to the hospital, it's not nearly as scary as it can be. It is also set up to be able to help take care of their families while they're here too. If you'll notice on the outside of Children's Hospital, we have these big white looking things that kind of give shelter over our entrance. Those are our sails. So if you look closely as we walk through Children's Hospital, you'll see that it is set up to be a ship. And so we'll be under the sea for a little bit. We'll have portholes that we can see the sea life around. And when we first walk in the door, you're going to see the reception reef. It's immediately to your right. This is where our families come when they're not really sure where to go and what they need to do. So they will come here, talk to the guest hospitality specialist here. I'm going to show you these amazing pictures of the sea life that is swimming from the ceiling. We also have a large enclosed fish tank for the children to go look at with saltwater fish in it. The guys come out and take care of it for us, so we don't have to worry about it. And you just get to see how beautiful our Children's Hospital is. Okay, as we walk down this hallway, you'll notice that it has curves in it. And part of the reason that it has curves is that they found through studies that children are less likely to be scared if it has some sort of motion and not just a straight line hallway, narrow all the way down. This pathway leads us down to where they do like radiology. We have our patients that come in that just need x-rays or little procedures done that can be done on the outside and then sent home. They come in here, they will come down and wait in this little waiting area. And further down is the Ronald McDonald House, and I'll show you some pictures of the Ronald McDonald House and how interesting that is and what it means to Eastern North Carolina for us to have an Ronald McDonald House inside a children's hospital. It's one of the largest ones in the country. Here in the little waiting area for radiology and P-Day, where our patients come in for their outpatient procedures, most of the time will be like our pediatric patients that have cancer and they need to have a treatment done, or our patients that have sickle cell and they need to have a transfusion done. They'll come in here and meet our staff, and our staff will take care of them, and then they can go home. They don't have to be hospitalized for this one little procedure. And used to, we would hospitalize them overnight and then send them home the next day. Now we just bring them in for a couple of hours and they're able to go home, which is really great. So in this little waiting area, you will see we have interaction wall. The kids really love coming and play over here. They can take and touch the wall. It goes from a beach scene to a under the sea. They're able to pop bubbles. It keeps them entertained and kind of relaxes them a little bit before they actually have to go back in P-Day or go back in the radiology area and have their procedure done. Most kids love it. Our adults love it too, but we're not allowed to play on it. Anyway, so let's go down here to Ronald McDonald House and let me show you some pictures here. This is where our families can come and stay. And while they're here at the hospital with their child, they're able to come down here, wash clothes, shower, make a meal, get some food, because families come in and they donate food for it. And so they'll cook meals down here for them. They're able to come and relax. It's more like a home feeling. There's a little play area for kids so that the younger kids or their siblings have a place to kind of get away from the hospital setting. This is a way that the family can kind of relax a little bit and have a little bit of normalcy. It's really hard to have a normal life when you're in the hospital, but this at least gives them a little escape. They can come down here, catch a drink, or get a little snack, take that well-deserved shower that they've not been able to get, and then, they're able to go back and be next to their child. We also have a Ronald McDonald House across the street where families can stay. If they're greater than 30 miles away, they're allowed to come in and stay there so that they're close to their child. There is a small fee. I don't really remember what it is. Next, we're going to go to the second level of our little ship here, and we are going to look at Special Care Nursery. I'm going to give you a little idea what it's about, and I will also give you a little tour of our CISU. Special Care Nursery first is a 21-bed unit. It cares for infants that are hospitalized due to prematurity, that are ready to go home, that still need a little bit of monitoring, or parents need some help with their feeding and helping them grow a little bit. Each family has their own little private room. It's really neat. Actually, here's a picture of one of the rooms. We try to make it as comfortable as we can. Now, onto our CISU. So you may want to know what CISU stands for. It actually means Kids Immunosuppressed Specialty Unit. This is a 6-bed closed unit that we will staff with like 2 nurses and a care partner to cover all 6 of the patients, because we actually use this as for our oncology patients. So immunosuppressed is usually our oncology patients. We will put other well kids back here as long as they don't have any infections, because we have to be very, very careful for our patients that have the immunosuppressed issues going on, okay? So here's some rooms here that you can see. I'll show you through. There are some activity rooms. I'm going to show you our picture of one of our relaxation rooms where our team can put a patient in there, do procedures in there, and then they can look at the ceiling, watch a movie. They can blast off into space, or they can do sand art. They can change all the colors in the room to match whatever favorite color. It's just a good way to distract our children. We have a bell here that when our oncology patients finish up their last treatment, they get to ring the bell and go home. We make it a big deal. This is sometimes the reason why you'll see our colors different at night when you drive by Maynard Children's Hospital. So if you ever see a different color out there, if you look on Facebook, on our Maynard Children's Hospital Facebook page, it will probably tell you exactly why we changed the colors, because we allow the patients to actually go push the button to change it to the color that they want. And it's a great celebration for a lot of our families and patients that are getting ready to go home. The nursing staff join in. I mean, all the staff make it a big deal. Okay, next we're going to go to the Pediatric Intensive Care Unit. We call it PICU. This is where we take care of really, really sick kids. Usually our nurses have 1 to 2 patients when they're caring for them. We have a 12-bed PICU. It is very much for those very, very sick kids. These patients here really need a lot of attention. The nurses are constantly in their rooms. Our parents are still allowed to stay at bedside as long as they can, as long as there's nothing really, really bad going on with the child. The general peds floor is a 32-bed unit. Within this unit, we have 6 beds that can be our transitional care units. This is where our nurses could have 4 to 5 patients at a time, unless they're on the TCU hallway. That hallway only allows them to have 3 patients at a time because those kids are a little bit more busier. These are usually kids that have chronic problems. They are usually having a home ventilator. They have different things going on with them that it really makes it hard for the parents to take them home right now, or they've had an issue that they need to come in and have fixed. So these kids can be very, very busy. Once these kids are better, we just transition them home. We also have a playroom that our kids are allowed to go to at certain times that open. Our child life specialists run this. They will have toys that are age appropriate. They'll work with the kids. Our child life specialists are really great. They are such a benefit to Children's Hospital. They are also the ones that will do that distraction. They're the ones that bring coloring books or bring an iPad. They help the parents understand what's going on. They will stay with the child and do little games with them when we have to do certain procedures. They give them a chance to play and be kids. We also have a teen room in there, so those teens can go in there and they can hang out, they can play video games and feel a little bit more like they're at home. That's a little bit about our hospital and our units. Oh, wait, I forgot about NICU. So we have a neonatal intensive care unit, which is NICU. This unit has 50 beds. It's on the first floor. These are babies that are born premature and they need extra help with either breathing and growing. They just weren't ready to come be born yet. So these are really, really tiny babies in there. Most of our nurses down there will have a 1 to 2 or a 1 to 1. It just depends on the acuity of the patient. So they're very, very tiny. We don't really allow a lot of people down there because we don't want our babies catching anything. So even if we were walking around on a tour, that would not be an area that we could see. So now let me tell you a little bit about the staff around here. So everybody knows that there's pediatricians and that we have doctors around here and that, they go to school for 4 years, then they turn around and then they have like another 4 years of a residency, then they have another 4 years if they're doing a fellowship, if they're specializing, whether it's in pediatrics or going to the PICU or even down into NICU. So we have, a neonatologist down there. They're very much trained before they come here, and we do train our own. So that makes it nice. A lot of the residents from Brody School of Medicine come back and work with us. We really do enjoy having them come back and work with us. So we have them. We also have nurse practitioners. Now, our nurse practitioners are mostly in the NICU and the PICU. They are nurses that have gone back to school and become a nurse practitioner, and they're allowed to write orders, they help with procedures, they do procedures. They're almost like a physician's assistant that most people know about, except they're nurses. And most of them have worked here prior to going back to school, and now they've come back and they're helping us care for our patients in a different role. They're actually an extension to our attendings, who our doctors, our primary doctors, so that they can help them when they're busy and have a lot going on. Then you have your nurses, our staff nurses that take care of these patients. Most of our staff nurses are 2-year to 4-year degrees. We really like them to be a 4-year degree BSN. However, we still take ADNs with them signing a contract that within 5 years they will get their BSN. We have found over time that BSN really does help a nurse grow, and so we want to encourage our staff to grow. Also, with helping the nurses, we have nursing assistants. So our nursing assistants are 1 and 2. They start off with going to, I think it's like a 3-year program, a 3-month program, and then a 6-month program. NA1s are 3 months, and then after that, NA2s are 6 months. And they have to take a little test, and they have to pass like a boards, just like nursing does, to make sure that they can care for patients. And so ours will come in, and they, it sounds like a lot when we say they take care of 8 patients. Well, they do it with the help of the nurse, but they do a great job of it. They still take care of the patients. They will walk them, they'll hold them. They do different things with them, help change diapers, help feed them. They're really a great asset to our team. Also, within a hospital, you won't believe how many people make it run. We have even our own chef down in the cafeteria. We have our EVS team. Our EVS is the environmental services. They're our cleaning crew. They come in and break down our rooms. They clean our rooms. They make sure our hospital is beautiful and clean, especially during times like this. They're wiping everything down to make sure that our patients don't catch anything here. We also have our secretaries who work really hard to answer the phone. They do a great job of making sure our families have what they need, and that helping the charge nurse who is running the whole unit at the time when they are here. I don't know how many of y'all will be going to medical school or going into medicine. It really is a very rewarding career, and it really is a great place. But I'll tell you, the best place of all is Children's. Working in Maynard Children's Hospital, I tell everybody, it's one of the best places in the world. It is like working at Disney. There's no better place to me. I have been here off and on for about 28 years, and so it really is a great place. If I left and came back, that says a lot. Anyway, I am so glad I was able to share Maynard Children's Hospital with you so that you could get a little peek at what we look like and what we do here, and just kind of have an idea of what happens here in Children's Hospital. Thank you.
Awesome. So Robin During is here with us today, and we are opening up now for questions through our chat session. So if you have questions, please feel free to enter those through the chat. And we have Ethan who is going to help us with the questions. So he will call those out, and Robin will be glad to answer questions, and I can assist as well. So fill up that chat bar, and we are open for questions for really the next 30 minutes.
All right. So we have one question coming in from Krista Hines. She asks, how long do nurses have to go to school to just work with babies?
Okay, I was trying to figure out how to unmute. Y'all guys can hear me now? For nurses to go to school, it really depends on which route they take. If they go to a 2-year community college, it'll take about 2 to 3 years, depending on when they start and how soon they're able to get in. Majority of the people will go to a 4-year college, and it takes 4 years to become a BSN. Now, some people go back longer, like me. I have an MSN and an MBA, so that has taken me 2 more years on top of the 4 years of a BSN.
All right. Hannah Faust is asking, what is the average salary for an RN?
Well, now that'll depend on what state and what area you work in. Usually they can start anywhere from mid-20s up to 40, depending on what they're doing. That's an hour, like so mid-20, like $25 an hour up to $40 an hour, depending on how long they've been here, what they're doing, and what their specialty is.
Catherine is asking, how long do pediatricians have to go to school?
General pediatricians usually end up like 8. If they want to do like a fellowship for like a peds ICU or neonatal, that takes an additional 2 to 3 years, depending on where they're at.
All right. I'll give people a few more minutes to maybe get their thoughts together, see if they have more questions. In the meantime, I'm curious, how have you seen healthcare specifically with children change, like with COVID? Have you seen more like telehealth appointments? Just walk me through that process.
So with COVID now being one of our main concerns, we've tried really hard to make sure that we protect our patients and their families. So telehealth has become a very big use now. Also with like some of the specialties like physical therapy, speech therapy, using platforms like this to be able to give them those treatments so they don't miss out on it. It's anything we can do to keep them out of the hospital. I have to say that with people being concerned and wearing masks, it really has kept our admissions into the hospital down. And that has been really great that we're really not seeing a lot of sick kids right now. Now, we do still see them, but not at the extent that we were thinking we may.
Catherine also wants to know how much money do pediatricians make?
That I do not know. I'll be honest. I've never asked them. I didn't want that kind of responsibility.
No, that's totally fair. What is your favorite part of the hospital?
Just working with children. If y'all couldn't tell from the video, you can tell I work with children a lot, just the way I speak. I love that interaction. I love knowing that I'm able to care for the child and help them through a very bad time, and also be able to help their family adjust and deal with what's happening with their child.
Awesome. Krista wants to know, what is the average net worth for a job at the Children's Hospital, and also if you know what a neurosurgeon's salary is.
I don't know what neurosurgeon's salary is. What was the first part of that question again?
She said, what is the average net worth for a job at the Children's Hospital?
Net worth, I'm not really understanding that part of that. Now, what an average, I'm not sure about what the average annual salary is.
What is a normal schedule for a doctor like, or what's a normal day?
It depends on what they're doing for which doctor. So like our pediatric intensivists, they will actually work 12-hour shifts. They switch off a day and a night shift, and then they kind of rotate. Our pediatricians do the same thing, but they may not always be in the hospital. They may actually be at their clinic, but then come in and see patients. So it varies depending on which area you go into. If you decide to be a pediatrician in the community, then a lot of times it's Monday through Friday, 8 to 6, or and some Saturdays, depending on the needs of the units.
So Krista asked, do you have to go directly to medical school after college, or can you do something in between?
If you're trying to go to a doctor to become a doctor, yeah, you can do in between. I know that some of ours have done like, done mission work. They've gone out and, got that experience to be able to bring it back as, doctors. And some of them do it while they're even in school.
Kelly wants to know, do you all offer internships/job shadowing opportunities at the hospital?
We at one point were offering like job shadowing, but because of COVID and the other things that have been going on and having so many people wanting to go into nursing, which is really great, we've had to limit that because of the fact that we really need to give these nursing students their opportunity at the bedside to be able to learn so that they can go on to be great nurses later. And so we've kind of limited that at this time. Now, if we open it up later, we'll definitely make sure people know.
Hannah wants to know, how old do you have to be a nurse? I feel like you could maybe also answer that with what credentials, what degrees you also need for that.
Okay, so I know of nurses that, because of the way high school works now, they can do college courses at the same time. I've actually seen 18-year-olds in here as nurses. They graduated early. They went and got their 2-year degree. We have a ribbon program that works with our community colleges that allow them to get a 2-year degree, start working, but at the same time completing their BSN. And so there's so many different opportunities with that. So I've seen them as young as 18. I've seen us as old as 60 starting because they decided this was the career they wanted and they had the opportunity to go back to school. Now, for credentials, I started out as an ADN nurse. I went to 2 years to Pitt Community College. I came in, nursed for about 13 years before I decided I wanted to go back for my BSN. I went back for my bachelor's, so I did a bachelor's in nursing, and that really helped me get into education because I really do love talking and teaching about pediatric patients. And then I decided that I wanted to do my MSN so that I would have that master's, because as you decide to become more involved in different aspects of a hospital, whether it's education, whether it's leadership, you really need those higher degrees, and it really does prepare you for some of the things that you will experience. Now, I do have an MBA, and I'll tell y'all that was from being when I was 16. That was always a dream, just to have an MBA. Now, it does work really good for me, because I am able to apply that into education to see how well education is working, whether or not it really is giving us a return on our investment of what we're doing, and how to cut costs the best way we can.
I also just want to highlight that for those that are interested in salaries and how much money certain jobs make, if you want to go to www.nccareers.org, there's a lot of information there. And that's in the comments if you want to scroll through that. Okay, so this is for Miss During and Miss Turner. What made you all want to choose this career path?
Now for me, I will tell you, I did not want to be a nurse. I didn't, and I'm honest. I fell into it by accident. I had some really great ex-in-laws that told me I needed to go to school to do something, so they put me through nursing school. They thought I would be great at it, and they were right. I worked as a nursing assistant. I worked as an LPN. I then graduated with my ADN. I was a single mom. They helped me through all of that. And I tell people all the time I fell into it. And when I did, I fell in love with it. The aspects of the things I do, and I guess I never realized I was one of those caregivers that would love nursing, because I didn't have that in my family. And so I grew up in a small country town. And so, that wasn't something I thought of. And they actually thought of it and encouraged me and supported me through it. And my parents did too. So I couldn't beat that. And then, like I said, I got into the PICU and I fell in love. I did. I fell in love with nursing. I fell in love with what I did. I fell in love with being able to help these kids and their families.
I would just say that I fell into this job. I've worked in banking and insurance and in hospitals, but when this job opportunity landed in my lap, my basically detail, organization, planning, event planning, is what I'm accustomed to doing. And I guess the cherry on top of the cake was working with the students. And that has what has become so fulfilling to me, is kind of guiding them on their pathway and open up doors and seeing the light bulbs go off. So knowing that I have that capability of just kind of bringing the two groups together, the hospital setting and working with the students in the schools, and just showing them opportunities. And then even the opportunity to say, well, gosh, that's not what I thought it was. And, that's not going to be for me at all. I don't like that. Then that's still a win in our book, because we would hate to see somebody waste their time, their money, their parents' money, or whatever that might be, and be in a job that they don't like for the rest of their life. So the earlier that we can introduce these options and careers and pathways to students, the better. And so, again, we just love that opportunity to show the students all the different fields that are out there. And it's not just nurses and doctors. There are so many fields inside any hospital or healthcare setting that's out there. So I've just loved every bit of this job that I've come to know at Vidant Health.
Emma wants to know that if you want to be a surgeon, what major would you need in college?
An actual surgeon, it would still be an MD, and then they would specialize in it. And I'm not sure how they get to choose their specialty, but I know that they start out with a 4-year degree. And once they get that MD, then it's like they know their paths they want to go, and then they're directed to those during their residency.
Robin wants to know, what is the position called again that does play therapy with patients, and what type of degree and training do they need?
That's our child life specialist, and they actually have a 4-year degree. ECU has a child life specialist program, and we require that they have this 4-year degree. Everybody thinks that they just play, but in reality, they offer so much support emotionally wise. They also help us when we lose our patients. They're there for our families, for our staff, and they're helping us adjust to those. And then when we have those patients that we're just not able to figure out what's going on with them, as far as like getting them to do, procedures or getting them to understand what's going on, they're right there with us, and they help us transition all that and help the families and the children. So child life specialist is really a great job, and 4-year degree, that's,
Do you work in all sections of the hospital?
So with my job as a professional development specialist, which is basically an educator, yes, I do. I cover mainly children's, but I also cover the adult MICU, which is our COVID unit. I get to work with everybody across, whether it's in the cardiac tower, whether it's in radiology. I get to actually work with them some, and that's really great.
Can we work in different units at the hospital, or do you have to get training in like the specific unit areas?
So the blessing and the greatest thing about nursing is that you can come in, and we have so many different areas in nursing. We actually have a central staffing team that we've been hiring new grads into recently, and they go all over the hospital. They start general med surg. They don't come to children's yet, because we really are a specialty, and we have to be really strict on who comes to our area and what kind of training they've had. So if they're in the adult world, if they do a central staffing position, they can go all over the hospital. Most of the time, people will go to an ICU, or they'll go to a general floor. When you get into those, then yeah, there's certain units that you can be pulled amongst. So like in children's, working in PICU, I would actually get pulled if there was a need to peds, down to Nicu, special care, nursery, KISU. I would actually get pulled around to wherever there was a need if our census allowed it in the unit.
Are there Maynard hospitals all around the country, or is it just localized?
So Maynard Children's is localized to us. Now, there are children's hospitals across the country, and believe it or not, it's a very small world, because there's people I know in different children's hospitals, like Children's Hospital of Orange County, Children's Hospital of LA, that I've worked with in different aspects. And so Maynard's right now, we are only located on the East Coast of North Carolina. Maynard's James and Connie Maynard are actually the one went to ECU, graduated from there. They own Golden Corral and wanted to give back to the community. And so they gave a huge donation for us to build that new building. And believe it or not, that was such a blessing because I'd been here like 20 years and we had been trying to get that building built. And so Maynard, the Maynard stepped up and helped us with that. So we're truly thankful to them.
A student wants to know if there's still a volunteer program with the Children's Hospital hopefully once COVID passes, and if so, how old do you have to be to volunteer for that?
Our volunteers are, they work with somebody different, but once COVID lifts, I'm sure we'll have volunteers come back. I really think they have to be 16. That I'm not sure about. Nancy may be able to answer that one better. And we have only certain ones that will have come up. So it's we still restrict it. But a lot of times they'll come up. Some of our older ones will read our babies or rock our babies. We'll have some that will help transport, like walk with them to places. So we have them all over the place, but they will not be like completely assigned to peds.
I was going to add in, I believe you do have to be 16. It's an application process, but due to COVID last year, they were not able to process the applications and do interviews and take on any new volunteers. So I think, I don't want to speak out of turn, but I do believe that previous volunteers were allowed to continue in certain roles and in certain areas, but not completely throughout the whole hospital. Of course, not in the COVID units. But I can't speak as to this year. I don't know that applications went out for this year either due to COVID. So it is a very valuable position. The volunteers, the adults and college students and the teens are all needed. But again, with the aspect of being under 18 years old as a teenager and exposing them, we do have to be cautious of that. So that is a completely different department within the hospital. And they do have a director and an administrator. So those are being managed through that department. But it is out on the website. If anyone's interested, you could check the website for vidanthealth.com and look under volunteers. And always check for that information as to when they are accepting new volunteers and the applications and that information.
What are some other careers that someone can do in the Children's Hospital that maybe doesn't work directly with patient, but still allows them to feel like they're helping and giving back?
We have admissions. So in our admissions area, we have people that are there that are admitting in our patients. They help them answer questions, get them logged in if they're having just one, if they're coming in for a procedure, or if like some of our women, when they're coming in to have babies, we have them. We also have secretaries. They're not direct care, but they do work in children's. They help us out greatly. We have our secretaries that are our secretaries to our leaders, like to our managers, to our directors. So they are available. They help assist our staff and assist our families. So it sounds like there's not a lot, but we even have our own dedicated environmental people that come in that clean our floors, clean our rooms. They're very much part of the Children's Hospital and very much part of our family. And so they actually work very, very closely with our families. Even though they don't do direct care, they will help them find someplace. They will go in the rooms and pull trash for them or help them get things cleaned up. And we've got one or two that will ask, can they pray with them? And they'll sit down and pray with them.
So this is a question from a student. It says, would you recommend somebody to take a shortcut or to do a whole 2 or 4 year program to become a nurse or doctor?
So this is the way I tell everybody what works for you. So when I started, I was a mom. I had a 2-year-old running around and trying to do my best. And so I needed to kind of get in there and make some money pretty quickly. So the 2-year route was better for me with going back later. Now, the way we work here it's you go for 2 years, and then after you graduate with 2 years, you come in, we ask you to sign a contract that within 5 years you'll have completed your BSN, and we give things to help do that. We help with tuition reimbursement. We help with flexible schedules so that our team can go back to school and they can continue to grow. So it really is on a person-to-person base. If you've already started taking college courses while you're in high school, take the college transfer ones. That way you know that as you go through, whether you end up in a 2-year community college or a 4-year college, you're going to have those behind you. That puts you ahead of the game. When I was going to school, I didn't have money, so I even had to do Pell Grants. So when I did that, I made sure that the other classes I took besides my nursing ones would go to my BSN. And I always thought ahead. I always did those classes that I knew that could apply for everything else. You kind of have to set those goals, even if you have to set tiny goals. Like I said, I even worked as an NA1 and NA2 for a while because I needed that money. And then when we used to go get our LPN, which we can't really now anymore. We really do encourage people to go ahead and get their ADN. And then that way I was able to work all the way up and make money.
A student wants to know, what is the average thing you do daily / how long do you work on a given day?
So now I have a different schedule than most of my peers, but as a nurse, it's usually a 12-hour shift. There are some specialty areas like radiology, some of our GI areas that the nurses may do like a 7 to 11, 11 to 7, or a 3 to 11, those kinds of things. So that they are able to be flexible with their schedule. I really do like the fact that you can work 3 12-hour shifts and you're done for the week and you have 4 days off. The schedules normally start anywhere from 6:30 in the morning to 7 at night, or vice versa, 7 at night to 7 in the morning. So it really is kind of flexible. Now, they normally, like the bedside nurses normally work 36 hours a week. Sometimes they'll work over if we have a need. So currently with COVID, we've had some needs. And so some of our nurses are actually working 4 days in 1 week and 3 days in the next. That gives them 84 hours in a 2-week period. My hours are a little different because I am in education. I'm a salaried person, so I work basically 40 hours a week, but I get to do 4 10s or 2 12s and 2 8s, whatever the need is for the units and how I can best support them with the education that the staff need to continue being the great nurses that they are.
What types of traits should you have to become a nurse?
What kind of traits? I really think you have to care. And you want to help others. Now, a lot of people will say, well, you can't be squeamish over blood. You can't be squeamish over needles. I don't like needles. I don't like to get stuck. I tell people that all the time. I never look. It's better to give than receive. So that will not deter you from it. You really have got to have that caring and be willing to get your hands dirty. I miss that part some days, the being able to go in and touch a patient, wash them, give them a bath, talk to them, and give them that overall care. You really have to be able to do that.
What is a pediatrician's main position or job like in a children's hospital?
In a children's hospital, they'll round in the morning. They will find out what patients are in. Most of the time, if they have their own private office, they come in and they see their patients, and then they may go back to the office and see their patients there. If they're what we call a hospitalist, where they're more for us, they are around all the time. Right now, they go home at night and sleep. We're able to call them if we need them, but our kids on the floor are not sick, and so they will rotate like days and nights too. They come in, they see all the patients, write some orders, make some suggestions, help the residents to make sure we're making the right decisions, and then they're done. Most of them teach, or they do other things throughout the community, or they have clinics that they go to.
This next question says, how often do they work with social workers? I'm guessing they meaning nurses, or potentially just how do social workers kind of fit into the environment at the hospital?
So social workers are our case managers too. That we could not survive without a social worker. I will tell you, they have probably the hardest jobs because in the hospital, they're reaching out to all our other social workers in the community to help make sure the resources are there. They're having to call the families, see what kind of resources they need. They're there to help, travel the healthcare route and make it as easy as they can for our families and help them with the resources that they need once they leave the hospital. So we work very closely with those. We have them in the hospital, and then we work with those outside in our health departments and our social services areas so that we're able to make sure our patients are still getting the care and have the resources that they need.
To be a surgeon, do you need to go and get an RN first, or can you just go straight through residency after school?
So to be a surgeon, I would go into a 4-year college, go ahead and get your MD, and then go for your residency from there and go the route of the surgeon that you want to go for. So I know people that do kind of go the route of the nurse and then go back to medical school. But in reality, if that's truly what you want to do, I would go that route first and I wouldn't take the nursing route. And it's not because it does you good to know what the nurses do. However, when you come in as a resident and are doing your fellowships and your residencies, you'll work closely with the nurses and you'll see what they do. And we all work very valuable. We value each other because it's very much a team and we have to be a team.
Does the Vidant Health Maynard Children's Hospital have their own standalone emergency room, or does all emergency and trauma care happen through the main hospital?
So we do have a children's emergency room. It is back near the adult emergency room. Our goal eventually would be to have our own. We're not a standalone children's hospital because we do have, we don't have like surgeries. We don't have those capabilities. So we'll be, Vidant Medical Center does provide all those stuff for us. And it's really a great partnership. I have seen standalone children's hospitals. It's a little bit harder on them because there's sometimes that they lose a lot of money based off of healthcare and some of the needs that the children need. And so by pairing with another hospital, they're able to maintain and be able to be there for when children need help. So Vidant Medical Center and Vidant Health as a whole really tries hard to make sure that we have all our needs and, that we're able to support children in Eastern North Carolina throughout our whole system.
What is the biggest challenge in nursing?
Losing a patient. I think that's the hardest part. Some people will say working with families. I'm very much one, you don't judge a book by a cover. Every time I've judged somebody, they have proved me wrong. And so I gave up judging people a long time ago. I treat them the way I want to be treated. And I normally don't have a problem with that. And I normally get a lot of respect back from families because of that. But when we have to lose someone that we've been taking care of for a while or even a short time, it hurts me. I can cry with a mama, I can cry with a daddy. And I'm going to tell you, the first time I saw a daddy cry because he lost a child, it undid me. But I was there for them the whole time. And I will tell you that I have one that I actually knew before they came in, and both the mom and the dad reach out to me on her birthday and tell me thank you for everything I've done. And they include me in on the little celebrations. And that's been about 15 years now.
Yashika students or Miss Dudley students, want to know what additional training / classes can they take in addition to becoming a nurse to help working with children?
To be actually with children, there's not much more you're going to do than what the general nursing programs do, because what happens in general nursing programs is you get more of the med surge and you get more of the adult areas, and then you do get a small piece in children's. And as I tell most people that are going to nursing school, don't put your heart in one place. You may think you want to go and do one thing, see it all, and then decide, because you may get in an area and then it may change your mind. I thought I wanted to go work on the neuro floor and the trauma floor. I just knew that was what I was going to do when I graduated. I got over to Peds ICU and peds and fell in love. And I actually had a job, because back then you could interview beforehand. I actually had a job before I even graduated. So my thing is that get into nursing school and then decide as you go through each of your clinicals what area you want to work. If you know you want to work pediatrics, then definitely make sure you pay attention when you're in peds to make sure that truly is what you want, because that is the beauty of nursing. We all come into it different. I have people all the time say, I don't know how you do what you do. And I look at them like, I don't know how you do what you do. I can't work with adults. And it's not that I can't. It's just that is not my forte.
All right, so we have about 4 minutes left. There's one more question. We'll see if more people pile on last minute or not. Catherine wants to know, if you had to pick a new position, what would you choose?
If I had, I don't know that I would choose anything different. Right now in my position, I do love helping the new nurses come in, helping them grow, helping them decide how much more education they need, making sure they stay current. So I've always been an educator, and I truly have been blessed. I would not leave PICU. I did have an injury at one point, and the surgeon asked me, had I ever thought about giving up bedside nursing? And I asked him, had he ever thought about giving up surgery? And he said no. And I said, well, me either, And so I wanted to make sure I got back. And in my position now, I miss the bedside part, but I really do love working with the nurses and helping them have what they need and helping them grow to become nurse practitioners, or to go back and become a certified, registered nurse anesthesiast, and being able, help grow them, because I love seeing it. As I tell everybody, I love seeing the light bulb come on, and somebody's got to take my job. So I really need people to grow, and so that I can retire one day. I have a grandbaby now, so.
All right, this will probably be our last question. But can you get a scholarship to nursing school?
You can, and I don't know what ones are out there. I would really, really reach out to the colleges, to like ECU, to Pitt Community College, or any of your community colleges around, to see what scholarships are out there for nurses. I do think the North Carolina Board of Nursing has some scholarships listed out there. I know that when I came through, there were different ones. So I would definitely ask the community colleges, your counselors, even at school, your counselors at school can help direct you on where to find those scholarships. And Pell Grants, they're out there, and, that helps some of our students be able to cover those costs.
All right, one more came in. The super fast in our last minute. What courses do you recommend middle and high school students to take if they want to get into a clinical position?
I would definitely look at your health services classes that you have at your high school, if they have those. If not, then look at doing NA1 or NA2. I know of 16-year-olds that have done their NA1 and NA2s and then work part-time as nursing assistants to, decide how they wanted to grow. So, look for those resources and start talking to your community colleges, because they really can help you with those courses and which direction to go.
Awesome. Well, I just wanted to, there's one more question. Will being a part of Health Science Academy help me get hired at the hospital?
So yes and no, because it's an experience. And a lot of times our Health Science Academy end up becoming NAs. And I have seen a lot of them be hired in because of the experience and the exposures they have. So I highly encourage it, because then that way you kind of know if that's something you really want to do. I feel like it's very rewarding. I've watched some of my daughter's friends actually go through it and watch them grow. And there's one of them, she's in nursing school to be a Nicu nurse. That has always been her dream, even though I told her, I was like, wait until you get in nursing school before you truly decide where your heart's set at. And, I've just enjoyed watching all of them grow. And so I feel like it helps. It gives you that knowledge, and it kind of gives you that head of the game of what to expect.
Awesome. Well, we are at time. But we just wanted to thank Ms. During and Ms. Turner for taking your time to talk to everyone.
Well, I very much enjoy it. So I'm glad that they're interested. And, you know, I love sharing what I do and trying to help the best I can to guide people with, you know, those resources and to know whether or not they want nursing or even healthcare, period.
Thank you, everybody. This was fantastic. I'm just amazed at all the wonderful questions.
All right. Thank you guys so much. We will end it there.